kencing lah.
This is common situation happen to the elderly.
Why this situation happen?
Let's dive deeper into our topic, incontinence.
Incontinence among elderly. What is incontinence? In general, incontinence is a loss of control over urination in the bladder known as urinary incontinence or inability to control bowel movement called as fecal incontinence. Now let's move to the types of urinary incontinence. Stress incontinence occurs when there is a leakage, urine that increase abdominal pressure such as during exercise, coughing or sneezing. Next, a sudden need to urinate and cannot hold until reaching the toilet, known as urge incontinence. Overflow incontinence occurs when bladder is not completely emptied, leading to constant dribbling of urine. Functional incontinence happens due to physical or cognitive impairment that prevent timely toilet use, while mixed incontinence is a combination of stress and urge incontinence. How about types of fecal incontinence? Fecal incontinence can be classified in 3 types. Urge incontinence is a strong urge to bowel movement, but insufficient time to reach the toilet. Seepage incontinence is a unintentional leakage of small amount of stool after normal bowel movement. Passive incontinence happens when unintentional leakage of stool without awareness. Did you know the prevalence of incontinence? Urinary incontinence (UI) is an acknowledged health concern in Malaysia, particularly among older persons. According to data from the National Health and Morbidity Survey (NHMS) 2018, the overall prevalence of UI among Malaysians aged 60 and above is 5.2%, with mixed UI resulting in 1.3%, and stress and urge UI each resulting in 2%. In another study of older women in the Klang Valley, Ramasandran et al. 2020 found that mixed UI was the most common subtype, with a higher frequency of 30.8%. For fecal incontinence, it is frequently underreported, making it difficult to determine its prevalence due to social stigma. However, the prevalence ranges from 2% to 21% in the general adult population. Studies show that approximately 7% of women under 30 experience fecal incontinence, and it increases to 22% among women over 70. According to reports, the prevalence among geriatric patients can range from 10% to 25% of hospitalized patient, and from 25% to 35% of residents of nursing homes. Now, let's take a closer look at the signs and symptoms of urinary incontinence. To begin with, the first one is frequent urination. This means needing to urinate more often than what's considered normal, which is typically more than 8 times in 24 hours. Moving on, we have the sudden urge to urinate, also known as urinary urgency. It may come on so quickly that the person cannot get to the bathroom in time. Another common symptom is leakage of urine. This is one of the most noticeable signs and can happen unexpectedly. It might occur when laughing, coughing, sneezing, lifting heavy objects, or even during physical activity, and it often leads to embarrassment. In addition, there is the inability to hold urine. This happens when the muscles that control urination are too weak or too overactive. The individual might feel an urge but cannot stop the urine flow in time. There's the persistent feeling that the bladder is not fully emptied. This sensation can cause repeated trips to the toilet with little relief. It might indicate overflow incontinence, where the bladder fills up but is not completely empty, resulting in dribbling and a constant feeling of fullness. We also see cases of only passing small amounts of urine. In some situations, even when the urge to urinate feels strong. This can be frustrating and may indicate that the bladder isn't fully emptying. Only a small amount comes out. Next, the signs and symptoms of fecal incontinence. The most common sign is the unintentional loss of stool. This means the person may unknowingly pass stool during daily activities or rest. Next, soiling of undergarment. This can happen due to leakage of stool or staining, even after using the toilet. Discomfort or irritation around the anus. This can be caused by constant moisture. Skin breakdown or inflammation due to leakage. Lastly, difficulty controlling gas. While it may seem minor, this symptom can be a sign of weakened muscles or nerve damage in the anal area. This is one of the contemporary issues that occurred in Malaysia on 9 January 2020, involving a heartwarming incident where a nursing student went out of her way to assist an elderly disabled woman who was experiencing incontinence at a public transport hub. If you were in this situation, what would you do? As occupational therapy professionals, how can we educate and support the patient? Diet modification. Avoid caffeine, fizzy drinks and spicy foods, because these can irritate the bladder, which lead to incontinence. Behavioral training. This includes toilet training and bladder retraining. We also help patients develop a toileting schedule to reduce accidents. Strengthening exercises. Pelvic floor muscle training, such as Kegel exercises, can improve bladder control. Daily life skills. Training focuses on toileting, hygiene management, and mobility to help patients be more independent. Occupational therapy education. Occupational therapists provide both emotional and physical support to help patients cope better in their daily lives. Complications of incontinence. Skin infection. Constant moisture from urine can lead to skin irritation or infection, especially in older adults. Risk of fall. People may rush to the toilet, especially at night, which increases the chance of slipping or falling. Social withdrawal. Some individuals may avoid social events or gatherings because they feel embarrassed or worried about their condition. Interfere with daily life activities. Incontinence can affect daily tasks like going out, sleeping well, or doing hobbies due to fear of accidents. Good prognosis of incontinence. The outcome really depends on three things: the cause, how severe the condition is, and the type of treatment given. Early intervention is really important to improve outcomes. Lastly, those who are still cognitively intact tend to have a better prognosis. However, there are also bad prognosis. First, issues like dementia, diabetes, stroke, and medication side effects can complicate treatment. Second, cognitive or physical frailty can affect a person's ability to stick to recommended exercise routines. Lastly, some people believe that incontinence is just a normal part of aging, which delays them from seeking proper treatment. Conclusion. Incontinence is common in the elderly and can affect their daily life, confidence, and health, but it should not be ignored. The good news is, it can be managed with the right support and simple treatment options. As caregivers, we should give care and respect to help the elderly live more comfortably and confidently. Thank you for watching.